In today's video, we're going to be talking about the management of hypertension or high blood pressure. Hi, I'm nurse practitioner Jessica, and we're talking about the management of hypertension or high blood pressure as you may know it. We're going to talk about three different perspectives: the traditional management, the alternative management, as well as possible outcomes if it's untreated. So let's start with traditional management, right? So we of course want to do regular monitoring. I am looking at my notes because I've taken notes about how to keep me a little organized, so excuse that. But we're talking about regular monitoring at home is the best time. I think for me, I like to tell patients that you want to be in your natural environment when you're checking your blood pressure. That's going to give you the more true, because then you shouldn't have the anxiety that comes along with checking the blood pressure at home in the doctor's office, right? So checking your blood pressure on a regular basis at home. It doesn't have to be every day unless you're taking blood pressure medication, and you may want to check it a little more often versus if you're just checking it and I think everyone should check their blood pressure. I'm not going to ramble, so we're going to move on. But regular monitoring at home and in your doctor's visits. Management, right? Or the prevention. Some of these go hand in hand with prevention, as well as if you're already diagnosed, right? So a healthy diet. We like to talk about something called the DASH diet. And it's just a diet that consists of being increased in fruits and vegetables, whole grains, lean proteins, decreasing the salt. And we'll talk a little bit later about why decreasing the salt is important for high blood pressure, decreasing saturated fats and cholesterols. If you stay tuned and continue to watch these videos, we'll go deeper into some of the topics of nutrition and things of that nature. You want to decrease your salt intake with high blood pressure to less than 2,300 milligrams a day, which is very hard to do because there's sodium in almost everything that we consume, unless you're eating more of the fruits and vegetables that are more natural, right? That's a whole nother topic of natural fruits and vegetables with the climate that we're currently in 2024. But let's talk about physical activity. Physical activity is very important with high blood pressure because it allows the blood vessels to be more relaxed, not have so much resistance, things of that nature, which also can decrease the pressure that is put on the blood vessels and in turn the organs of the body. So you want to get at least 30 minutes of exercise. So if you're not currently exercising, right, we're not going to just start doing 30 minutes unless you can tolerate 30 minutes. If you can tolerate it, then by all means. But just a brisk walk, right? Get your heart rate up just a little bit. Brisk walk. You want to work your way up to that long term of 30 minutes a day, at least 5 days a week, which will give you about 150 minutes of moderate aerobic activity. Or if you're more of a modest athlete, right, you can do a 75-minute vigorous workout a week. That will help. Weight management. So studies have shown that decreasing your weight by at least 2.2 pounds, which is like 1 kilogram, that burns off 7,700 calories, right? So when you think about, as much calories as we take in with the food that we eat nowadays, which is really high, you can burn off a lot of that with that exercise, changing your diet, things of that nature. But weight management is very important because that 2.2 pounds can decrease the blood pressure reading by at least 1 for 2 pounds, right? You want to limit alcohol. If you are male, average size male, no more than 2 drinks a day, alcoholic drinks. If you're a female or a smaller built male, then no more than 1 drink a day, if at all. It will be best not to drink at all. That'll probably be another video, alcohol intake. Stop smoking if you are, because it does increase your risk of cardiovascular disease just by smoking alone. You want to decrease your stress by doing things like deep breathing. Trying to look at my time. Okay. Deep breathing exercises, meditation, and yoga, or relaxing hobbies like gardening, right? We're in a moment of time now where you see a lot of people gardening, and they do so for a number of reasons. And in one, it is a very relaxing hobby, as well as providing those fruits and vegetables that you need, if unless you're just doing flowers, well, but that can just be a relaxing hobby. Um, then we're still on the traditional side, right? So medications. Some medications you may encounter um, diuretics that help with the blood pressure. So basically, they help to decrease that sodium that we talked about before, because where there's a bunch of sodium, there's also water. So that in your blood vessels will increase the pressure that's put on those vessels, which increases your blood pressure, which puts more pressure on those organs as the blood passes through those organs, right? So that's how you end up with things like kidney failure, things of that nature related to blood pressure. Calcium channel blockers. Um, these are medications that they relax the blood vessels, so that helps to decrease the blood pressure. Your ACE inhibitors are ARBs. They relax blood vessels, um, which allow the blood to pass a little bit better and decrease the blood pressure. Your beta blockers, you don't see a lot of these prescribed necessarily for blood pressure nowadays. More so, we use them a lot of times for like to decrease heart rate, because they do decrease the heart rate, which decreases the workload on the heart, and the heart is what pushes the blood against those vessels, which will can cause the blood pressure to be up. But by taking the beta blockers, it decreases that workload. The heart doesn't work as hard, and it allows the blood pressure to be lower. Okay, so those are some of the medications. Those are just the generalized categories. The names may be, different, but some of the categories that we use to prescribe blood pressure medications. Then let's talk about some alternative management, which at ARS Medical Primary Care, we're not opposed to a combination or one versus the other, right? This is just a brief intermission because I do feel this is very important to speak about being a healthcare provider. When you think of blood pressure in particular, which is what we're talking about, and the use of alternative, right? I'm not opposed to it, but I am opposed to only using alternatives without checking to see if those alternatives are actually working until there's something catastrophic that happens, like a stroke, heart attack, things of that nature. So if you are doing alternative management, which is things like using which they're good, that's good, you're still using things like diet and exercise, decreasing the stress. Those are all parts of traditional and alternative management. And I know some people don't like to take medications for their own reasons, whatever those may be, but for me as a provider, if you're coming into the office and your blood pressure is extremely high, then there may be a time that you may need to use those medications as short term, just until we can get the blood pressure under control. And then if you choose to do more alternative, we can monitor your use of alternative with the medications and slowly trickle down on or titrate down the blood pressure medicines while you're doing diet, exercise, and stress management, things that we talked about before. So that is a possibility. That's how I like to look at it as a provider here at ARS Medical Primary Care. That scenario doesn't always work for everyone, and some people do have to continue on medication, but the evaluation is the important part here. So when we're looking at monitoring that blood pressure, It's very important to still have a primary care provider, even if you're using alternative medicine, um, or alternative techniques to treating the blood pressure, which lifestyle management is basically all that is. And it's very important because medication alone is not going to allow it will get your blood pressure under control. It can potentially, but in the long run, you will end up having to take those medications for a lot longer than you probably would like to, unless you did lifestyle and the medications, and then slowly continue the lifestyle things and titrate down on the medications. But some of the alternatives are your herbs, some of the basic ones that we see, and there's so many things out here, and I may touch bases on those a little bit later in another video. But you're looking at garlic, hibiscus, fish oil, some of the known ones that we use. We talked about decreasing the stress, DASH diet with your fruits and vegetables. We didn't talk about some of the foods. So green leafy vegetables, high in potassium. Bananas, high in potassium. If you don't have a diagnosis that keeps you from using potassium, those are some of the good foods that you can use. Berries are high in flavonoids. Those help decrease blood pressure. You have beets. They are high in nitrates, which inside the body, they transfer over to nitric oxide, which helps decrease the blood pressure, as well as other things that it may help. Nuts like almonds, walnuts, let's see, chia seeds, flax seeds, those pumpkin seeds, high in magnesium and potassium. And so that helps to decrease the blood pressure as well. So we're going to move right into, because I'm not going to hold you too long. We're at 11 minutes now. The seriousness of not treating blood pressure. And it's not a scare tactic. It's more of just education. I feel that what we lack in today's healthcare system is having that ability to educate people. Now, we know there's time constraints based on where you work and things of that nature, but education is a huge part, because no provider can be with you 24/7, right? When you're not in the office to tell you what things you should and should not do. So if we can educate you while you're on those visits, then that helps to be able to help you with your lifestyle. But some serious complications that can occur from not treating your blood pressure, okay? Of course, we talked about cardiovascular disease. High blood pressure puts a strain on the heart and the blood vessels, and causes conditions like cardiac artery disease, heart attacks, and heart failure. You can have a stroke, which is a major risk. Depending on how high that blood pressure is, you can have a hemorrhagic stroke, which is very hard to come back from, if at all. Ischemic strokes. Let's see, kidney damage, like we talked about before. High blood pressure puts a lot of strain and pressure on the kidneys, which damages the nephrons in the kidneys, which are your filters, and thus end up leading you to a life of dialysis and possible kidney transplant, which is not a hard thing, which is a hard thing to come by. Peripheral artery disease, because high blood pressure causes narrowing and blockages in the arteries of the legs, arms. Let's see, where else? I mean, anywhere that we have arteries, everywhere. So those arteries can get narrow and causes decreased blood flow, right? So then you're not getting the appropriate amount of blood to those areas, which can lead to things like pain in the legs, which is called intermittent claudication, pain in your calf muscles when you're walking that subsides when you sit down. That's an indication that you may have peripheral artery disease, and you need to seek medical attention to have that addressed. There are techniques that are being done to help treat those illnesses. People end up with gangrene just due to the lack of oxygenated blood to the muscles or tissues, and then that tissue dies off because it doesn't have the oxygenated blood, causes gangrene, and then you end up with amputations or infection in the blood, which can seriously cause damage to the body. And just to name a few that I may not go in full detail in this video, You can have from high uncontrolled, non-treated blood pressure, no matter if you're using alternative or traditional management, aneurysms, vision loss, metabolic syndrome, dementia, sexual dysfunction, and in the end, it can cause death due to these illnesses going untreated. So it's very important if you do have high blood pressure. It's important to prevent high blood pressure by doing your lifestyle things, eating properly, getting appropriate exercise. But it's even more just as important if you are already diagnosed to prevent the progression of the high blood pressure to becoming these other illnesses. And so that's all I have for today. So that's our note from ARS Medical Primary Care. If you are looking for a primary care provider, we are in the Charlotte, North Carolina area. The information is in the description about how you can contact us to schedule an appointment. We will be opening up telehealth appointments here in the very near future. And so I will come back to you with that information as well. Make sure you like and subscribe the video, subscribe to the channel, like the video, so that lets me know that you enjoy this content. And I will continue to make this type of content and provide this type of information to help you in your journey as I use it to help me in mine as well. And until the next video, take care of yourself and always remember, we're all human.